All right, everybody. Let's get started. We have, again, like I had mentioned, Dr. Bruce Gewirtz. He is the Surgeon-in-Chief at Cedars Sinai, LA, and we're going to have a Q&A discussion similar to what I had done with Sam. And yeah, it's going to be really cool. So I'm going to just queue it up and we're going to get started. Keep in mind, everyone, this is the second to last of the programming, so please stay around. We have this conversation, then an awesome in-person kind of exercise thing that we're going to be doing here. So I'm going to turn my video on and just jam with Bruce in a minute. All right, Bruce, how you doing, man? Can you, let's get you set up. Just hit your video and yep, in a moment you should be good.
Because it's, oh, there I go.
There you are. How you doing?
I'm good. I'm good. Great to see you.
Likewise, sir. Staying healthy?
Doing my best. Doing my best.
So I have to ask you this, and this wasn't on this wasn't on our plan, but I think you'll be okay with this because I've had conversations about this before. How has your experience working at a hospital changed post-pandemic?
Yeah, well, you know, there's many stages here. You know, when this first happened, I think most all of us were caught unawares about the nature of this thing. And I think the first and very human reaction was that this was some kind of short-lived problem, that we would hunker down and stop elective surgery and, you know, we'd get through this difficult period, week, 2 weeks, a month. And even though Tony Fauci and other people all told us we were in the first half inning of a 9-inning game, I don't think anyone internalized that. So we, for the month of March, right in the middle of March, we stopped elective surgery and people took it really well. The patients took it well. The docs and employees took it well. Everybody's income here at Cedars Sinai was more or less protected, and of our employed people. And, you know, as time went on, we certainly understood that we needed to learn many lessons about the nature of the disease, the transmission of the disease, the treatment of the disease. And they were all good lessons, and we got much, much better. And by the time the wave of the disease hit Los Angeles, the mortality rate at Cedars Sinai was, of admitted patients, was about 10%, which was much lower than was experienced in New York, where they were losing 70% of their ICU patients. But when it became clear that this was going to go on for 6 months, 12 months, who knows how long, we knew that we needed to take a smarter strategy. So armed with what we learned, we started operating on patients more ambitiously, because we found that postponing all elective surgery, that most surgery was in fact not elective. It may not be emergency, but it's not elective. And 10% of our patients that we postponed were having complications that required them to be admitted anyway. So we took a much more proactive stance. And then, as we all know, there's ebbs and flows in this disease. And we enjoyed 2 or 3 months of a respite. But now we're picking up steam, albeit not as bad in California as many other places.
Okay. Before we talk about the conversation about challenges for physicians right now, let's talk about your background. Like, you've had a very successful, tenure with everything that you're doing. What has inspired you to keep, progressing in your field as a doctor and now as in the leadership side at Cedars? I'm just trying to want people to understand a little more about who you really are outside of the amazing credentials, which obviously has been shared with everyone.
Well, it's very kind of you. I think that the satisfaction that I've gotten from the multiple facets of my job has clearly been the driver for me. The more things I did, the more complete I felt as a person, the more challenged I felt. And, we always think that stress leads to burnout. But my theory is that stress with personal growth is the antidote to burnout. because we all know from sporting events or any other kind of endeavor that you have to challenge yourself regularly. If you're a skier, you have to take that tougher than usual run several times a day in order to progress. And without that excitement, for most of us, and particularly people that have surgical personalities, you stagnate. So the great privilege that I've had and the secret that I've learned, albeit, only in retrospect, I guess, but I made many of the right moves, is that by continuing to challenge myself, I've been able to sustain my enthusiasm. And I always tell people that, the job for all of us is to spend as much time as we can in our flow experience, in the things that we really enjoy, and to constantly challenge yourself. I mean, maybe not every single day, because there are some days that I just like to lay around and on the down low, but to recharge. But you do want to have what the astronauts used to say, an equal strain, a little bit of that edge in your life. So after 25 years at the University of Chicago, where I was chief of surgery for 15 of those 25 years, I took on another challenge 15 years ago to come here. And I just don't know that I could have picked a better route.
Yeah. Well, clearly, I mean, the work that you're doing is really, really amazing. That's obviously why we are honored to have you here. I want to talk to you about the main conversation now, which is, working the role of a physician in this kind of post-pandemic age. Reason why I think this topic, for everyone who doesn't know, why it makes sense for Dr. Wirtz to speak about this is because one of his roles, and I've seen this personally, is that he is actively teaching and mentoring, surgical residents, doctors, and other things that he has to do through his administrative leadership role at Cedars Sinai. So there are some people who are listening to this who are doctors, and there's some people who aren't doctors, or like me, who have respect for doctors, but we're doing our daily lives. But I think it's important even for us to know what challenges doctors are facing right now, and what advice do you give doctors right now in this kind of situation we're in?
Well, of course, it's true for physicians or anybody in life. You can't ever stop being grateful for the positive experiences you have and the positive influences you have on patients and other people. We most of us high achiever types tend to be overly critical of ourselves.
Yeah.
And we can't be perfect all the time, but what you can do is to always prepare, whether it's for an operation or an interaction or a business meeting, and do all you can on the front end to maximize your performance. And that can be a physical thing. I like to have a glass of wine the night before surgery. As I've gotten older, I've just not had a glass of wine. I've just consciously said, it may be 0.5%, but I'm going to maximize my physical performance. And I take care to go to bed at a reasonable hour, and I take care to calm myself and get my emotions in order, because I want to be as perfect and positive as I can be. So controlling your environment to the extent that you can, because you can't control all events, gives you a sense of empowerment. And then the other thing I mentioned earlier, and I'll expound on a little bit, is that have gratitude for the great opportunities that many of us have. And it may not happen every day. There may be some days that are tougher than others, but when you have a chance to reflect, have gratitude for the opportunities that you've been given. And oddly enough, the more you express that gratitude to others and the more you feel it in yourself, the more good things happen.
No, that makes sense. I was actually just jotting that down. I like that. I like the thing you said about controlling your environment. So I guess with Cedars Sinai, how are, what are some precautions I think that you recommend doctors to now take? Someone who might have been, entry level green, they just got thrown into this. Maybe it's their first year or two working at a hospital like Cedars Sinai. Like, is there any mental toughness, mental mindset advice you'd give them? And by the way, this question will be applicable for anyone who's a first responder of any sort. So it's not even just for doctors. So it's pretty much for first responders as a whole.
Well, it's a timely question because once a week I have lunch with a different group of house staff or surgical residents. And I ask them very directly, I acknowledge the fact that we're in a very difficult time because you surely don't want to downplay that. And whether it's my granddaughter who's missing her senior year of high school through no fault of her own, having a very different experience, or our residents who are having a somewhat different experience in their education process because of the current circumstances, you have to be realistic and acknowledge that this is a difficult time. We're playing a difficult course. Having said that, the thing that we look for in young physicians and particularly surgeons is people who are proactive at solving their own problems. And the way I approach the residents is to let them express what the most difficult, I went around the room and said, what's been the most difficult issue? Has it been your fear of contracting the disease while you're working? Has it been your lack of a normal social life? What has been the most difficult thing? And everyone has a somewhat different take on them. And then the next question is, well, what can we do to help you? Can you think of any solutions proactively that we as the administrators of this hospital can do to help you? And then finally, once I demonstrate our willingness to listen to that, which hasn't been so plentiful, but they feel pretty well taken care of for good reason, then I ask them, what can you do in your mind or in your activities and in your other behaviors to maximize the situation the way it is, and get them thinking about proactive things. And of course, it's dependent on each individual. Some person may be athletic, some person may be more cerebral, some person may lean toward the arts, but by encouraging them to, again, maximize their time in a positive environment, they can take control of the situation and feel better about it.
I agree that, controlling environment, seeing the positive aspects. You brought up something that I really love talking about, which is productivity and managing your energy. You mentioned the wine thing earlier, which I didn't even know that. That's interesting that, first off, actually, I'm curious, what was the reason for having half a glass of wine the night before surgery? Like, not you specifically, why do people do that? I'm just trying to understand.
No, I don't have, you mean drink less the night before surgery or drink at all?
Drink less the night before. You said drink a glass of wine the night before surgery, right?
Well, no, I'm saying that, I normally would have a glass of wine, with dinner. And,
yeah,
I often just omit that the night before.
I thought you meant a specific amount. I was like, okay, never mind.
No. I think I meant that, everything in moderation, and,
right.
even more so when we feel a physical challenge coming up.
Okay. No, that makes sense. I was just curious. How do you manage, because you juggle a lot. You have a leadership role, and you still do surgeries or other medical related work, and you are active, with the initiatives in the, with writing papers, doing presentations, doing things like this. What's your advice? Because you seem to have a good grasp of managing your schedule and your time.
Well, my wife would argue that nothing could be further from the truth. You call me at a bad day because I was supposed to go to Johns Hopkins and give a lecture today, but instead it was done by Zoom, of course, which necessitated me getting up at 3:30 in the morning to make a 7 o'clock presentation in Baltimore. So I'm at the tail end of a long day, and I still have a dinner ahead of me. But yeah, I mean, I think that looking at your calendar weeks in advance and trying your best to allow for sufficient times for whatever you value, whether it's family time, exercise, going to a show or whatever, and plotting that out and planning that out offers you the best chance to actually achieve that. So management of your schedule, if I don't schedule in recreational time, it's not going to happen, because the time will just get filled up with whatever needs to be done. So again, I think that the theme here, and I hadn't really thought about it nearly as much until you're probing questions, is to take charge of your life, and your schedule and your ability to do that may vary based on your status and your job and all that stuff. But we all have that to some extent. And then, although events occur that are going to disrupt that, if you don't take charge of it to begin with, you've got zero chance of accomplishing what you want and keeping an even balance between your personal and professional life.
Okay. Well, my final question, and I feel like right after this, you're going to go take a big nap or something. So my final question before you pass out.
No, actually, I'm going out to dinner with friends. So no luck. Yeah.
Well, pre-dinner nap. I love those. Basically, I want to talk about right now, any final advice on challenges that you have had to face during this or even in the past. And I'm asking this because I want people to learn from your example. I'm a big fan of the case study model where, instead of just giving a lecture or giving a theory, it's like, well, here's a situation that I had to deal with. All the odds were against me and this is what I did. Yes, I learned. I might have fallen off initially, but I got through it. So I just want to know, like, in your professional role, what is a situation that would be helpful for rising doctors or even people who are at your level or soon to be your level could learn, like a situation? And if you need a moment to think about it, that's fine. We have a little time.
Well, the reality is that there are many things that happen like that have taught me valuable lessons, and it's a question of which one I pick. But one that bubbles to the surface is when I was made chairman of the Department of Surgery at the University of Chicago at a very young age, 42. And I was also proposed to become a member of the American Surgical Association, which is the senior surgical organization in the United States. And even though I was a little young for that, because of my status and new stature, it looked highly likely. And quite candidly, I had never not become a member of whatever I wanted to become a member before. But there was a senior surgeon in the United States who wanted that job and did not get it because I got that job. And he made it his business to block me on my first attempt from getting into this honorary surgical society. And it was, in my view, unjust, but worse than that, it was literally the first time something like that had happened to me. And, I had to regroup. And I remember distinctly, I was in Washington, D.C. with my son, who was about 7 years old at the time, and my parents who were visiting with us, and we were going on the sightseeing tour of DC. And here I had what appeared to be this huge professional blockage. And really the first thing that anyone had ever done negatively to me in my profession. And yet I wanted to have a great time with my son and my parents because I knew it was going to be a memorable time. And over the course of 4 or 6 hours, I just came to grips with the fact that this was the other guy's problem. It wasn't my problem. And that in the pantheon of problems, I should be able to internalize this and handle it and get over it. And I did. And I understood the dynamics of it. I analyzed it through, and I was actually maybe able for one of the first times in my life to simply just put it behind me. And a year went by, the issue was rectified. The person was cautioned that was an unprofessional behavior, and I was welcomed into that group, which of course had very minimal benefit or a real impact on my life. But like everything else, it's the clubs that you're blocked from getting into, not the clubs that you're into, that make a difference. But I was reminded of the Groucho Marx line that I wouldn't want to be a member of any club that would have me. And that put it in perspective. And that little bump in the road went away. But the point I learned was that that oftentimes when someone does something negative to you, it's more your perception, and it's much more a reflection of their own negativity than anything that you did. And sometimes you just find yourself in the way of someone who wants to act out negatively, and you just have to shrug it off and keep your course.
Well, that's awesome. Well, Dr. Gortz, thank you so much for joining us. Sincerely appreciate you taking the time, and have a good dinner. And I cannot wait to. What's great about these conversations is that they're recorded, so we can't wait to share this to other people. I'll make sure you get a copy. But it's good to see you, my friend. It's been a while.
Well, Ash, great to see you, and thanks for a terrific program. I enjoyed it.
No problem. Thanks.